Are there any healthy salt substitutes for individuals with hypertension? Have you ever wondered how something as simple as salt can impact your health, especially if you have hypertension? Hypertension, or high blood pressure, is a common condition that affects millions of people worldwide. One major factor contributing to hypertension is excessive sodium intake, primarily from regular table salt. Reducing sodium consumption is essential for managing blood pressure and lowering the risk of heart-related issues. So, what are some healthy salt substitutes for individuals with hypertension? One popular option is potassium-enriched salt substitutes. These substitutes replace some or all of the sodium chloride in regular salt with potassium chloride. Research shows that these potassium-enriched substitutes can help lower blood pressure. They do this by reducing sodium intake while increasing potassium intake, which helps relax blood vessels and promotes the excretion of sodium through urine. Large-scale studies have demonstrated the effectiveness of potassium-enriched salt substitutes. For example, a study with nearly 21,000 adults found that those using a salt substitute containing 25% potassium chloride had lower rates of stroke and major heart-related events compared to those using regular salt. This benefit was noted even among older adults and those with existing hypertension, without causing harmful increases in potassium levels in the blood. However, it is important to note that some individuals should be cautious when using potassium-enriched salt substitutes. People with advanced kidney disease or those taking medications that increase potassium levels should avoid these substitutes unless supervised by a healthcare provider. This is because they may be at risk of hyperkalemia, a condition with dangerously high potassium levels. Aside from potassium-enriched salt substitutes, there are other flavorful alternatives to reduce sodium intake. Garlic, lemon juice or zest, ground black pepper, and various herbs and spices can enhance the taste of your meals without adding extra salt. Additionally, incorporating potassium-rich foods into your diet, such as spinach, sweet potatoes, bananas, cantaloupe, and avocados, can support blood pressure control. For those managing hypertension, switching to a potassium-enriched salt substitute can be a practical dietary change. Here are some tips to consider. Choose salt substitutes labeled as light or low sodium, which often contain potassium chloride. If you have kidney issues or are on specific medications, monitor your potassium intake. Complement these substitutes with a diet rich in fruits and vegetables high in potassium. Lastly, consult with a healthcare provider before making significant dietary changes, especially if you have underlying health conditions. In summary, potassium-enriched salt substitutes offer a healthy alternative to regular salt for individuals with hypertension. They can contribute to lower blood pressure and reduced cardiovascular risk when used appropriately.